about the clinical side of autism. And we have a social expert as well in our panel. So I'm looking forward to this session. And like we normally do, any other webisode of All About Autism that you have watched before, we'll have a panel discussion. Definitely, there will be some performances in between. So do watch out for those performances as well. And towards the end, we will leave about 10-15 minutes for our panelists to answer any questions that the viewers might have, and they'll try to answer them live. So if you have any questions, please put your question in the comment field of this Facebook Live that you're watching from Sangeet Foundation Facebook page. So with that, without wasting any more time, it's time to introduce our panelists. So let me introduce now our core team member and one of our panelists who you've already seen in our previous webisodes, Dr. Arghya Sarkhel. Can we have Dr. Sarkhel on screen, please? Great. Dr. Sarkhel is a consultant psychiatrist with more than 25 years of professional experience. He's also one of the trustees of Sangeet Foundation, and he's a founder of Living Mind, which is an independent mental health organization. Thank you, Dr. Sarkhel. It's really, again, very glad to have you today in our session.
Thank you so much, Navarupa. Thank you, Sangeet Foundation, for having me on the panel, and quite proud to be the trustee of Sangeet Foundation as well. So really looking forward to a brilliant sessions organized by Sangeet Foundation.
Great, thank you. With that, we'll move on to our next panelist, who is also another core team member of All About Autism series. He is Mr. Ujjwal Banga. Can we have Ujjwal on screen, please? Mr. Banga, welcome on board again. Mr. Banga, he is the founder of SEFI, which is Social, Economic, Environmental, Educational Foundation Initiative, which is a charitable organization involved in various social projects to foster cohesion in our diverse society. Welcome, Mr. Banga. Really pleased to have you today in the session.
Thank you, Navarupa. Thank you so much. And it's my privilege to work with you all. I'm really happy to actually work together. Thank you. And of course, yes, it's always happy to work with Sangeet Foundation and Living Minds. We are actually together.
Fantastic. Thank you. Thank you so much, Mr. Banga. And now, last but not the least, our very special guest panelist today is Dr. Nishchint Warikoo. Dr. Warikoo is a child and adolescent psychiatrist with over 15 years of professional experience treating all child and adolescent mental health conditions. Dr. Warikoo is also a qualified educational supervisor, trainer, and was the associate director for Sussex Foundation Trust. He has a special interest in neurodevelopmental disorders and gender identity dysphoria. Welcome on board, Dr. Warikoo. Really pleased to have you today in our session as the guest panel member.
Thank you very much, Navarupa, and thanks to Sangeet Foundation to give me this platform where it will be helpful to spread information about autism, which I think we need to spread more and more. So thanks again for the organization.
Brilliant. Thank you so much. And as I said, we have got quite a few interesting questions that I've got in store for me, and I'm really kind of looking forward to start asking those questions one at a time, and let's engage into a very interesting conversation. So to begin with, obviously, we talk about autism. We talk about the fact that, it's a spectrum, ASD, spectrum of disorder, but we never actually, in any of our webisodes so far, try to kind of find out that how and when this word autism was coined. Why is it called autism? Has it got any specific reason? So I don't know whether Dr. Sarkhel, would you like to take this question?
Yes, I think, as always, a brilliant question of history to start the event. Need to know a bit of the origin. So, when you talk about coining any special word, we always rely on two languages in the world, I think, Latin and Greek, and this time they haven't disappointed us. So, if we go back to 1910, there's a Swiss psychiatrist, Eugene Bleuler, and he was working on patients with schizophrenia. And that is where he first used the term autism, and it came from a Greek word autos, which is originally coined from Latin word called autismus. And what it means in those languages, that someone who is removed from social interaction. That's what it means. So almost in their own self. So that's where it's all started. 1910, Swiss psychiatrist. Probably some of the symptoms that time we didn't know much about the psychotic illness schizophrenia, but yes, one of the symptoms we know that they get withdrawn, they don't have social interaction so much. We call it now negative symptoms as we know more about the illness, and that is where the autism began. And then if we move forward another 20 years, another psychiatrist, Leo Kanner, and used the word autism in the sense that we use it now.
Okay.
And, worked on really just 11 children to begin with, a very, very small sample size, and looked into some of the typical problems, communication, behavior, and again, social isolation is a key thing. So that's how it started, really.
Great. It's interesting that connection with the social and communicational
Yes.
challenges, it always were there with this word autism. So thank you for sharing that, Dr. Sarkhel. So obviously, challenges with autism and this spectrum of disorder, we would talk more about this, but generally, there is always this kind of general question that comes up that is autism genetic? Does a child, when a child borns, is the child born with autism, or there are parenting style or parenting side of it has got influence, or rather I would say general environmental influence is there on a child to make the child more towards the autistic spectrum disorder?
Yes. So, and again, if we could just continue this conversation around the history, then the Leo Kanner that we talked about, when there was a work on autism, initial work, there was a question about, it's all due to parenting style, lack of parental warmth. And there was a term they coined that time, refrigerated mother. So it was all about autism was all due to the poor parenting style. It really took almost up to 60s and 70s to find out that really it is a neurodevelopmental disorder. The genes or the genetic loading has a lot to explain for it. Of course, there are environmental contributing factors, but at the end of the day, it is very much, we call it a mental illness, but I think we should say it's a biological illness, because 60s and 70s studies, the twin studies, that's how we find out how much any disease is genetically related. If there are identical twins, then chances if one twin is affected, then almost 80% chance another twin will be affected with some kind of autistic spectrum disorder. Right. So it just tells us that how heavily it is genetically loaded.
Okay.
But of course, there are other things. I'm sure Dr. Warikoo, the expert in the neurodevelopmental disorders, will enlighten us about the effect of the environment. For example, maybe during that time, how the pregnancy went for mother, some kind of immune problems and stuff. We know lots and lots, but still we do know that lots and lots of different genes are involved. There is no specific one gene for autism, but it is very, very genetically loaded.
Right, but definitely that myth of what the term you used is refrigerated mother, that's a completely wrong myth.
Correct. Absolutely. Yes.
That's good. Thanks for clarifying that, Dr. Sarkhel. With that, I'll probably move to Dr. Warikoo now. Obviously, Dr. Warikoo, knowing that your specialization is more towards the child and adolescent psychiatry. So, with that, what I would like to understand is, like, what are the symptoms that you generally notice in a child who is on autistic spectrum disorder? How do you diagnose that that child has got autism?
I think it's just to add on to what Arghya was saying, is that it's a neurodevelopmental disorder. So any neurodevelopmental disorder is present since the child is basically born. So it's not something which will come in later on in the life. There isn't any specific thing which can make someone get autism. So if people are worried that we might catch autism, you won't. If people are worried some later on event in the life would give us autism, no, that doesn't happen at all. So that's a basic thing. The other important bit about autism to understand is that it is currently being considered a disorder, but the plan for the future is that it will be probably taken out of that category of a disorder. Because anyone who has autism, basically they are quite fine in themselves. There's no problem. The problem arises because of the environment they are in. That's the social environment they are in. And that can cause lots of problems. So I'm giving this context because that will help us in when we talk about the symptoms, which allow us to diagnose someone with autism. So the key things are in the diagnosis of autism are two main things. So first is the social communication and interaction. So that's very important to remember, the social aspect of it. And the second is people with autism have they would have repeated behaviors or set patterns of doing things which they keep on doing. So if we take the first one, that's the social interaction. There is a difficulty in social communication. So what the word used for people who don't have autism is also called neurotypicals. So neurotypical people is people without autism. So neurotypical people communicate with each other. They will look at it. They will talk to each other. So that's words. They will look at our expressions. So like we are looking at you, Navarupa, you are nodding your head. So that's a way of communicating. I can understand you're listening to me. And there's a change in our facial expression. So those are subtle ways of communicating. So that's where they find difficult to take that information in. So, and another key thing is the tone of our voice. So we might say the same thing in different tones, and the same words might mean different meanings. But a person with autism would not be able to guess the other meanings. They will take it literally. So, for example, if someone says, "Oh, it's raining cats and dogs," so it's possible that a child with autism would actually go to the window and try to see whether there are cats and dogs who are raining from the sky.
Right.
So it's to that extent. So that's the communication bit. Then the social interaction. In any social interaction, there is always a give and take. So if we are talking to someone, we will say something of our interest maybe, and they will respond to that, and then they will talk about their interest and we'll respond. So it's a reciprocity in social interaction. And that's where the difficulty arises in autism, that they would probably not be able to socially interact in that way. They have things they enjoy, they have things they like, and it's difficult for them to then have that communication where they've been giving you the space almost in the communication. And this is not that they're being mean or anything. It's just how they are. Yeah. And there is the main reason behind is something that we call theory of mind. That is, neurotypical people are able to understand what the other person wants or what they have in their mind at a given position, because that is difficult for a person with autism to understand. So what your wishes are, what you're expecting them to do, it will be difficult for them. Hence, it has an impact on their social interaction. That's the second aspect of it. The third aspect, which I was mentioning earlier, is having set patterns or having repeated behaviors. So there are two things to that as well. The first bit is the world which we live in has blacks, whites, and gray areas. So that's okay for neurotypical. We can work with that. But people with autism, they almost live in a black and white world. And they don't understand why these gray areas are. It's very difficult for them to navigate this. So the uncertainty makes it very stressful, the situation very stressful for them. And then to help this, they try to maintain routines. So a child with autism would prefer to go to the school along the same route every day. Any change to that route would make a big stress on them. They'll find it difficult to, because it doesn't fit with the black and white way of doing things. The other aspect of the behavior is where children with autism might have repeated behaviors, like they might be doing hand flicking, flapping of hands, flicking of fingers, or they'll be rolling at one place. So those are slightly different behaviors. Those are to self-soothe. When they are very stressed, they would use those behaviors to soothe themselves. So these are some of the aspects which help us diagnose someone with autism. Now, this was more a general view of it, but depending on what age you are trying to diagnose someone with autism, you will get different things. So the core or the crux would be these things, but the presentation would be different. So if I give you an example, you can usually identify autism in a child who's even 6 months old, but there you'll see different things. So if usually between 6 to 12 months of age, if a mother usually smiles at the child would smile back. That's reciprocity. Whereas you might not get that in autism. The child would not smile back. Often a young child would, if they want their mom to pick them up, they will raise their hands like this. That's a gesture to parents saying, pick me up. But a child with autism might not be able to do that. So they'll be almost total. So that's that stage of finding out. Whereas if you are looking at a child in a teenage, the symptoms will be a bit different. So that's kind of the general overview of what the symptoms are. Sorry, I hope I answered that question.
Yeah, no, that's very interesting actually, like how the way you describe, because obviously those are the kind of expectations you have from a little baby, but yeah, when you actually don't see those instances, probably those are the early indications for the parents or people around, even that child is only a 6 months baby, to just be mindful of and be conscious of what's exactly going on. So I'll just probably take this little further, and in terms of these symptoms, I don't know, Dr. Sarkhel, what Dr. Warikoo mentioned about these symptoms. Do these symptoms actually vary when the child with autism grows into an adult, or then do you see changes in the symptoms generally? You're on mute, Dr. Sarkhel. Yeah.
Just realized.
Yeah.
So as Dr. Warikoo just said, the core symptoms are really same.
Yeah.
So the communication, the social reciprocation, understanding each other. Of course, if there is associated language development, sometimes can have, with some language delay. But if we move the child into adolescence and then adults, I think few things happen. There are two groups. So one group is who are already diagnosed with autism or autistic spectrum disorder from the childhood. And in a way, they are kind of slightly, I think, it is better because they already got the support system ready, or at least people around them, whether the teachers, parents, relatives, they know kind of what to expect. And trying to fill in the gaps as they go on to the adult life, because expectation is different. And this is very different story for adults who are not at all diagnosed and suddenly coming up with these problems for some reason or the other, stigma, taboo, or didn't get the opportunity to get picked up the diagnosis at the correct age. And that gives a big challenge for them, both in their social life as well as in their work life. And I mean, the last in this pandemic that we are still probably going through, it's a good example because many of them, a routine was upside down, and suddenly they could not cope. And many of them have got newly diagnosed autistic spectrum disorder in adults. So you can see some of these social challenges when routine is slightly out of the ordinary. In case there are any other significant life events, suddenly these symptoms become more obvious. It particularly becomes the high functioning autism, which also sometimes called Asperger's syndrome, who usually do not have language delay. And because they do not have language delay, they sometimes perhaps compensate or be able to mask the symptoms. You don't get those what I call raw symptoms.
Yeah.
So that comes very subtly. For
Mm.
example, very intelligent person, but not really performing well. What's the
Mm.
matter? Everything else was ruled out. So sometimes perhaps those autistic pathology is there that's responsible. So what I'm trying to say that yes, the core symptoms might be same, but presentations are very different because the context is different. The expectations are different.
Yeah.
I hope that just made it
No,
clear about.
yeah. Thank you for sharing that, Dr. Sarkhel. And as you said, it's difficult. It becomes more complex when it has been missed out or not
Yeah,
diagnosed in the childhood, and the symptoms are coming up in the adulthood, or obvious, getting more obvious in the adulthood. So with that, I think I'll move into the more treatment side of it, if there is at all any treatment, or what are the kind of options or treatment options do you provide? So maybe Dr. Warikoo, if you can help us understand that from the child adolescent perspective, what treatment options are available with children with autism?
I wish there was a straightforward answer to that question.
Yeah.
I'll have to again give a bit of background to this, why I'm
Yeah.
saying that. So as I said earlier, autism as such is not an illness. It is a disorder currently, but possibly it won't be considered a disorder in the future. So by themselves, autistic people are quite fine. They can manage most of them, unless and until there's a learning disability, as Dr. Sarkhel highlighted, it's possible. So the problem arises because of the response to them from others. The problem arises because of the environment they are in. The environment is not suited for them. We all live in those gray areas and we're okay with them, but not children or people with autism. So they struggle in this environment where there isn't the certainty which they need. And like all of us, if there is so much of uncertainty, we start panicking, we start worrying about things. And if that happens day in and day out, that can make us anxious. Not just general anxiety, it's the clinical anxiety to the level where they need treatment. So that's one aspect of it we need to consider. The second is, if someone is in this world where they don't understand what's happening, or the unpredictability is so much, and then they become anxious, if it continues for a long period of time, there's a possibility that they might have low mood, which can then lead on to depression. So with autism, you often get comorbidities, that is low mood, depression. And as Dr. Sarkhel highlighted earlier, if they have intellectual disability, then that's another issue there. Now, if a child with autism is having anxiety and low mood, or even if they're not there, but they are in this environment which is almost unpredictable, then it becomes difficult for them to feel calm. They're almost all the time on the edge, wondering what's going to happen next. So if someone is in that stage for a lot of time, then it's not a lot which would push them off the edge. So it could be something which is very simple, like someone says to them no for something, and the reaction would be huge. They might get very anxious, they might get very angry, they might shout, they might hit out, and they might do all the behavioral things which is not expected of a child of their age or an adult of their age. So that becomes a major issue. So we have an issue of anxiety, we have an issue of low mood, we have behavioral difficulties. And then, as if there is a learning disability which itself has sensory issues, or people with autism often have sensory issues as well. That's a very important thing for us to remember, because sensory issues are they're either hypersensitive or they're not sensitive. They're very less sensitive. So what that means is, basically, if you are in your room and there's a car honking outside, you might hear it and then you will just ignore it. But that might sound very loud to that person with autism. It's almost as if the horn is blowing in their ear. So if a child with autism is sitting in the classroom and there is some noise which no one else hears, but their hypersensitivity makes them hear it as if it's the loudest noise possible, then A, they won't be able to concentrate in the class. B, it will irritate them, and then it will take them to the stage where they're so irritable that they will get angry and behavioral difficulties will come up. So when we're looking at treatment for autism, as I said, it's not an illness, so there is no cure. As such, a person with autism doesn't need medication, but they need medication for all these other things.
Other things, okay.
Not only do they need medication, they need therapies. Not only they need therapy, the families might need therapy. So if I now go into the detail of the therapies, so for the sensory aspect, they need a sensory assessment so that people know what are their sensory issues so that the support can be put accordingly for them. So if someone is hypersensitive to noise, you could just give them an air defender and that will sort out lots of problems. If they're sensitive to touch, then you might tell people to stay away and don't touch them when they're not expecting it. So that's the sensory aspect of it. Speech might be an issue, so you might need help in this form of speech and language therapy. So that's another thing. If they're sensory, they might need support from occupational therapist. And because of all the difficulties, it might have an impact on the family dynamics. So family therapy is another thing that can be done.
Right.
So these are general therapies we're talking of. Now, because these people with autism, they are living in this world where they're expected to behave like neurodevelopmental people. So it's good to give them training much earlier, almost in this communication style, which doesn't come natural to them. So there are behavioral therapies which can be started at much earlier age. That's why the importance of diagnosing at a very early age, as soon as possible. Because then if you put those strategies in place, they know how to manage with the other people, neurotypical people. They would know how to manage in those unpredictable situations, and hopefully would have less anxiety, would have less low mood, would have less depression, and they would have a better trajectory to their life rather than not. Now, if they are seen later on in life and there's anxiety or depression, we do have to treat that. So then medication would be needed. And also, if there are behavioral difficulties, then we'll have to give them medicine for the behaviors. Sorry for this long answer to the question.
No, it's very, very interesting. Thanks for sharing that, because obviously, as you rightly pointed out, there isn't any medicine for autism, but it's all the other associated issues that can come up. Therapies, as I'm getting a gist that therapies probably is the kind of more essential things to go about and help the child with. But medicines are also available because if needed, medication is also an option. So with that, probably I'll quickly move into Dr. Sarkhel then. Obviously, Dr. Warikoo mentioned about all the behavioral issues and quite a lot about in the child with autism. But how do the behaviors actually change, or do they change at all when the child grows into an adult? You're on mute, Dr. Sarkhel.
So again, as I mentioned in the earlier section, that the expectations at social life, expectations at work life are very different. So that is where often those autistic problems, if we call them as at least deviation from neurotypicals, it becomes difficult. So I think the first thing is, as a relatively simple thing possibly could trigger a challenging behavior, and it could be in both ways. So as Dr. Warikoo talked about the sensory problems, that hearing or perceiving too little or perceiving too much. So similarly in the behavior, sometimes it can be challenging in a sense that might get a bit irritable, might lead on to aggression. Similarly, on the other side, they might get more isolated, more withdrawn. So challenging behavior doesn't necessarily mean that is always an aggression or violence at all. We have to think about two different types, and then it becomes more challenging because their communication style is different. So it's very important to understand what this adult trying to communicate to the outside world, because their way of communicating is very different than a neurotypical. So And same problem happens in their outside work, in their social life, with the friends, with the parents, with relatives, trying to communicate something. People wouldn't understand, becomes frustrating. Gradually, there's a build-up stress inside. And that can lead to sometimes anxiety, depression. The other thing as well I want to touch on, that sometimes people with autism can have intense interest in particular things, bit like obsession, very repetitive, very intrusive thoughts. They know they are not rational, trying to get rid of that, but it's very difficult. And sometimes that takes a big chunk of their life at the expense of other things they would be doing. So you can see the quality of life gets compromised due to these behavioral problems. And as we said, that unfortunately there isn't any anti-autistic drug like antidepressant. But certainly cognitive retraining is possible using cognitive behavior therapy in a very modified approach. Of course, depending on their language, because some of them have language difficulties, we have to tailor that. And it's ideas about linking between their thoughts, emotions, and behavior, helping them develop better coping styles. But fundamentally, I do think, like Dr. Warikoo said, is not just about the child and also the family. In adults, I think it's very important to work with the employer as well, which we hardly do. So I think for the viewers and listeners, it's not just about who is there, but actually people around them. We know in child there's a triangle exists, child, family, and the wider environment. I think we should have a similar principle in adults as well. And work is a crucial thing. Because the whole idea about giving the treatment is not treating those symptoms, but actually improving the quality of life. So when things are tough, sometimes they feel like world is broken in front of them. There is hardly anything to anchor onto. So one of the things I found in my clinical practice quite helpful to really give the sense about the gratitude, which is very helpful, very consistent source of a positive message that almost anything is not there, but actually that is our feeling, that's not the fact. There is a lot to hold on to. So
I think
things like gratitude practicing, I think, is a key to build up the resilience. Of course, in addition to some of the other more conventional treatments that we talked about, like CBT, etc.
No, I think you're right. Actually, the word gratitude, actually, it makes me think that it's not just for those who have autism in them. It's probably for all of us, isn't it? Because
Absolutely.
all the stress and everything that we are going through, is that sense of gratitude actually helps us a lot to overcome loads of challenges that we kind of day to day come across. So I think with that, Dr. Sarkhel, we, as we always say, that we try to bring in some performances, and we try to get performances in our previous episodes from our guests, but never did we hear anything from you. And we know that you are a very good singer. So
No, I'm not sure about that.
No. Can we actually, on this nice theme of gratitude, can we actually get to hear something from you, please?
Okay.
Great.
We'll give it a try.
So can we have Dr. Sarkhel's video on screen, please? I know.
আমি অকৃতি অধম বলেও তো কিছু কম করে মোরে দাওনি যা দিয়েছ তারি অযোগ্য ভাবিয়া যা দিয়েছ তারি অযোগ্য ভাবিয়া কেড়েও তা কিছু নাওনি আমি অকৃতি অধম বলেও তো কিছু কম করে মোরে দাওনি আমি অকৃতি অধম বলেও তো কিছু কম করে মোরে দাওনি যা দিয়েছ তারি অযোগ্য ভাবিয়া, যা দিয়েছ তারি অযোগ্য ভাবিয়া, কেড়েও তা কিছু নাওনি। আমি অকৃতি অধম বলেও তো কিছু কম করে মরে দাওনি। তব আশিস কুসুম ধরি নাই শিরে, পায়ে দোলে গেছি চাহি নাই ফিরে। আশিস কুসুম ধরি নাই শিরে, পায়ে দোলে গেছি চাহি নাই ফিরে। তবু দয়া করে কে বলি দিয়েছ, তবু দয়া করে কে বলি দিয়েছ। প্রতিদান কিছু চাওনি। আমি অকৃতি অধম বলেও তো কিছু কম করে মরে দাওনি। আমি ছুটিয়া বেড়াই জানি না কি আসে, সুধা পান করে মরি গো পিয়াসে। ছুটিয়া বেড়াই জানি না কি আসে, সুধা পান করে মরি গো পিয়াসে। প্রভু যাহা চাই সকলই পেয়েছি, তুমি তো কিছুই পাওনি। আমায় রাখিতে চাহো গো বাঁধনে আটিয়া, শতবার যায় বাঁধন কাটিয়া। রাখিতে চাহো গো বাঁধনে আটিয়া, শতবার যায় বাঁধন কাটিয়া। ভাবি ছেড়ে গেছো ফিরেছে দেখি, ভাবি ছেড়ে গেছো ফিরেছে দেখি। এক পাও ছেড়ে যাওনি। আমি অকৃতি অধম বলেও তো কিছু কম করে মরে দাওনি। যা দিয়েছ তারি অযোগ্য ভাবিয়া, যা দিয়েছ তারি অযোগ্য ভাবিয়া, কেড়েও তা কিছু নাওনি। আমি অকৃতি অধম বলেও তো কিছু কম করে মরে দাওনি।
Fantastic. That's such a lovely, soothing, and such a relevant song. Thank you so much, Dr. Sarkhel.
Thank you, thank you.
So with that, we'll move on to the next section of few questions. So, Dr. Warikoo, we have touched on this already, and you've mentioned about the challenges related to the social functioning. So, if you can actually kind of describe a little bit more on those challenges where an autistic child is actually facing in respect of social functioning and essentially the educational functioning of it as well, because the children do go to school. So what kind of educational on that front, what are the challenges an autistic child normally face?
Again, there isn't a straightforward answer to that, because as I said, there are so many other aspects that could be around there. If a child with autism has learning difficulties as well, then it makes the problem really complex and difficult for them in the school, in the education setting, because not only do they have the social difficulties and interacting with other people, they also have cognitive difficulties, as in difficulty in understanding what's being taught or remembering things and so on and so forth. The other complicated factor, which I didn't mention earlier, is that children who have autism, there is a high probability that they will have also another condition, which is called ADHD, which is the full form is attention deficit and hyperactivity disorder. And that brings its own challenges. That brings the challenge of impulsivity, hyperactivity, and those kind of things. If they are in addition to autism, then that can have a major challenge for the young person. But the good thing about, well, not good thing, but the positive thing about the management plan for ADHD is medication helps with that aspect of it. So now if we come to a young person who, let's say, doesn't have ADHD, does not have any other problem, the problems for them can start from the time they get up in the morning. And then the expectation that's of them. So if they have sensory issues, it will be very difficult for them to even wear the uniform or clothes. It will be very difficult. Then if they have any difficulty, sensory issues, then they might have difficulty in eating the breakfast. It might be a different form of breakfast which is right for them and which is not for them. When then they are going to school, if they are following a particular route, if for some reason they can't, just going away from the route can be a major problem and cause lots of distress to them. Then going into the school, as you know, there are other children. Children can be cruel when they are young, and if they pick on a young person who has slightly different ways of interacting, they can bully a child with autism. So that's one thing. Then the way of teaching, if it's not specifically tailored to a young person with autism, they will struggle to understand things. If they have sensory difficulties and if the teacher is teaching a bit loudly, that would make them not even able to listen because it's too much noise for them. So they'll find it difficult to concentrate in the class. Then as I was saying, other things about anxiety and if those factors are there as well, then there's a possibility that they might have behavioral difficulties in the class and not be able to do things as other children in the class will do. So there are multifaceted problems that they can face in the social setting almost. And then the playground is a big thing for the young people with autism. If it's very noisy, there are too many children there is no predictability in the playground. So if they go into that environment, it's really stressful for them to be able to function in that. The other thing which is important, we haven't talked about that, but the sensory aspect, we did talk about the sensory aspect, but to give you more understanding of what difficulties they feel in the sensory aspect is, if we take an example of we are in a room, there's a party going on, and there is someone next to us, and they are talking to us. So neurotypical people usually have the ability to just focus on what's being said and almost ignore the rest of the noise or rest of the sounds in the room. And you can have a conversation, though it's difficult, but you can have a conversation. But if it's a typical autistic person in that room, they won't be able to ignore all the other aspects. So not only are they hearing you, they're almost hearing every conversation, every noise, everything that's going on in the room. So there's a massive sensory overload on them. So if all of that is happening, and it's a similar thing in the classroom, any noise, they're listening to that, anything. So it becomes very difficult to concentrate in that environment. And I'm not saying all of these happen to all the children. There are different things. So to support a young person in a social or educational setting, the environment has to be changed. It has to be tailored to their needs. And that's why there are special education needs plans that can be put in place for children with autism. And there is now another thing which is called CTR. That is an enhanced support package for children with autism. So once the diagnosis comes, then they can get this support.
Okay, great. Thank you. That's really good information to share with all our viewers. Thank you very much for that, Dr. Warikoo. Just continuing with that theme, Dr. Sarkhel, if I move into the adults, the other challenges remain the same? Do they differ? And then there is for an adult with autism, another dimension to that is the occupational functioning of it, which comes into play. You did mention about employers earlier, but in this circumstances, from the occupational perspective, what do you think the biggest challenges are for an adult?
Yes, I think I'm just conscious of the time, so I'll
Yeah.
keep it brief. So I think in the occupational, the most important thing is I want to see that the professional, whether psychiatrist or psychologist, who is treating the individual himself or herself, and the employer, which they should all form the part of the team. I think that's fundamental because the perspectives can be very different. Sometimes there can be misunderstanding. From the occupational point of view, they might have some targets to meet, they might have some deadlines. We are all familiar with that. And it can be very challenging for them. As Dr. Warikoo says, sound, smell, taste, all these sensory things. It if what I mean, is impossible to adapt to every single needs, but whatever little changes we can make in their environment, that will improve the quality of their occupational functioning significantly. And this is something, a dialogue that has to continue throughout the treatment, rather than just writing a report to the occupational physician. Or I think it's a dialogue that they need to get involved into the care plan. So I think that's the only way I think we could help the individual suffering from different
Yeah.
symptoms of autism.
Yeah, great. Thank you. Thanks, Dr. Sarkhel. And as you mentioned, it's the continuous thing. It's not just a one-off report being
Absolutely.
done. Yeah, okay, that clearly makes sense. So with that, again, I know, Dr. Warikoo, you mentioned about some of the interventions, therapies, and the associated issues that come up alongside ASD. But are there any specific medical interventions that are effective in the development of communication, language skills in autism?
As Dr. Sarkhel had earlier pointed out, there are behavioral and behavioral techniques. So we call it CBT. That's cognitive behavioral therapy, which is tailored to autism. So that's one of the ways of doing it. The other treatment therapy is speech and language therapy. That's another one which can be helpful. And the third is the occupational therapy. So those kind of therapies help with that. And sometimes the young people might be too distressed to access any of those therapies, so they would need medication first to help them feel less anxious and be able to engage in those therapies. So those are the key ones, I would think.
Understand that. Thank you so much for that, Dr. Warikoo. So another interesting question. Again, sometimes people talk about these, like genders. Does the reflection of the symptoms, or the manifestation of symptoms rather, differ from one gender to another? Or maybe the severity aspect, does it differ again, or is it dependent on gender?
I think it does differ. So you'll have proportion of boys having more autism. The other key thing is when autism happens in girls, it's usually difficult to diagnose because girls are able to manage better. They are able to hide almost their emotions. Because women generally are better in socializing. So even with this kind of deficit, they still are able to do better than boys. And as long as they're keeping it quiet, they're just under the radar, they're managing things, no one almost picks up. And that's the worry, because then when they hit puberty, then the problems manifest. And often you would see girls mostly or mainly being diagnosed when they are in their teenage, because then all the ways they were trying to manage becomes not effective enough, because with puberty and all the changes that it brings, then it's much easier or for other people to see that there's a problem.
Okay, interesting. Yeah. Again, I think maybe I'll ask this question to you, Dr. Sarkhel. At some point, we did talk about comorbidity. We did talk about ADHD, depression, OCD. So clearly, now that you've mentioned that this is a kind of a neurodevelopmental issue autism is, but generally, how can a person, definitely it does from what you said, but is there any kind of coping strategy available where a child or an adult with autism having ADHD or OCD or depression, those other issues can be managed? Is there any strategy as such?
It's a good question because I think it should start from the assessment process itself. So, if we are diagnosing someone with ADHD, depression, OCD in the background of autism, then it's very important to understand those symptoms in the context of autistic symptoms, because that's fundamental. Because then only we can tailor make that CBT or cognitive behavior therapy to help them understand in their own ways between their thoughts, actions, and behaviors, and help them developing coping strategies. But the reason I've said tailor made, because standard cognitive behavior therapy, we expect to pick up the principles of CBT, challenging our negative thoughts. But in autism, it's quite different because their understanding is very different. So it has to be done at their level so that they can understand simple behavioral coping strategies. For example, if there any loud noise, as Dr. Warikoo correctly said, some kind of muffling arrangement so that they are not disturbed by it, or perhaps if they know that they're going to a noisy environment, having some pre-planned strategies, if you like, and those are all systematically addressed in the therapy sessions. So it's basically therapy oriented rather than any medical intervention or not any chemical intervention as such.
Sure. Okay, great. Thank you. Thanks for that. And I think we talk, or we are actually in this session talking a lot about people, child or adult, with autism. But I sometimes wonder really about the carers and the stress and their side of the story, how much they have to manage. So maybe we can have Mr. Banga on screen, please. I've got a quick question for Mr. Banga, because I think the carers and they're dealing with the situation, especially when in the society we have all these issues of stigma and everything, and mental health for the carers definitely matters a lot, because day in day out they're dealing with these challenges in the family or with the friends. So what is your take on this? Where can the carers get some help, or how can they manage the stress and anxiety that they go through to deal with autism?
Thank you, Navarupa. Very, very pertinent question. Actually, as an autism, we always know each child or each an adult, they're unique. And in the same time, as a carer, as a parent, or the support, what exactly it is there. So I understand it is always better. You first of all, in case as a carer, you have seen first time, or even maybe past also, what you can do is actually speak to your local GP, speak to Citizen Advice Bureau in case you are not aware of the things. If you have any friends, you speak to them, come out of the issues and all those. Now, when you find out that, let's say your child or you have a daughter, son, brother, or whoever has autism affected autism, you need to actually find out, as Dr. Sarkhel and Dr. Warikoo has said, try to understand the behaviors, try to jot down those things, speak to the GP or speak to the psychiatrist when you are meeting with them, and try to tell them that what exactly going through. Now, I understand the mental health of any person always be an issue, because on that particular time, the person is going through a loads of things, not only they for themselves, for their own child or their own, the caring you are. So what exactly you need to do is try to understand the issue. Don't panic. Take help of the community, the resources what around you have. Speak to them and try to understand what are the things you can do. Break it down and use those resources. And of course, yes, I mean, as we are living in UK at the moment and in different parts of the in the global areas or worldwide, different supports are available. Like, let's say in UK, you can having a when you are speaking to your, let's say, social worker or the psychiatrist, you can get a help from the carer assessment.
Okay.
Now, the carer assessment will give the details of the carer's needs and all those. And of
Yeah.
course, here's the local authority or wherever the person is. I mean, each local authority have their own sets of process,
Yeah.
and they will go through that. And the support, whatever they will be available, they will provide that. So
Right.
speak to your social worker, speak to them, and try to understand what exactly you are looking for. What are the support exactly you want?
Yeah. Yeah.
And I
Okay.
hope like that will be a first step. And of course,
Yeah.
yes, once you meet with them, that the steps will come up.
Yeah. You get to learn more about what is
Exactly.
available, and you get to.
But don't be stressed. Don't be like panicked. Oh my God, it is only for me. It is happening to me only.
Yeah.
Please come out of that stage.
I think that makes sense because that's the first thing, to come out and be mindful of the fact that yes, I'm going through that stress, so that I can then reach out and ask for help. So with that, I think as we are talking about mindful and being mindful and all the stress and everything, maybe I'll go to Dr. Warikoo, because Dr. Warikoo, you practice mindfulness, we know. So is there any quick presentation from you that we can get, where we can get some stress relief and be in a position to overcome some of the stress and issues that we go through?
I think mindfulness is a good thing to use, and for everyone, even if we don't have stress, it's good to prevent stress. We had a video on mindfulness, but given the time, we might not be able to present it today. But I think if people are interested, we can send the video to them after this presentation so that they can see it in their own time. And there was an additional bit to the video which I can write to, and we can send it later, if that's
Okay.
okay.
Okay, that's fine. Thank you. So if we can get that shared after this session, that will be very useful. So thank you for that. And then quickly moving on, just a very last question I've got. Any research that is going on in this field of autism? Maybe, I don't know, Dr. Sarkhel, would you like to take that question? Any current research going on? Yeah, you're on mute.
Of course, there are hundreds of researches going on as we speak. I just like to point out that there was supposed to be a big study kicking in UK called Spectrum 10K in association with UCLA. But unfortunately, that is on hold now and really the study wanted to look at the exactly things we are talking about. How much is the genetic impact? How much is the environmental impact? So I think the study will go ahead, but it's just on hold at the moment. But keep an eye on that. It's a Cambridge-based study, and they will be enrolling, they will be writing out. But at the moment, there's a bit of ethics issues and stuff, so they just wanted to take their time before they start the study. So that will be a very good study. In the US, there's a recent prevalence study which was showing around 1 in 54 children amongst 8-year-olds can have autism. And it's an important figure because it used to be 1 in 59 in the previous study. So it looks like that. I don't know whether that is due to the increasing awareness, whether people are coming more for help. But of course, as Dr. Warikoo says, if the disorder is taken off, then it might have a completely different dimension to those figures. But I think it's important to know that, all these more and more studies are going on. We know that there is a significant proportion, 1 in 54, I think it is not a rare problems at all. It's very,
No.
very common. And if we can pick it up early, it is not about medication. We can actually help them in their adult lives, improve their quality of life.
Yeah.
So, but yes, there are many, many researches going on as we speak.
Great, thank you. And that gives us the hope, really, because all these research outcome actually in future will help and support children and carers, adults and carers with autism. So thank you very much for that. So with that, I think we're very much at the very last segment with any live Q&A. I know we had been having the questions on screen time to time, but and some of the questions probably have been answered as we were into the conversation with the panelists. So the one that we can see now up on the screen is about social care and children with disability do not provide appropriate support to disabled child's needs, even after repeatedly writing letters by GP, MP, etc. So anything that you would like to comment on that, maybe Ujjwal?
Yeah, thanks for the question. Actually, at the moment, this all depends on the particular child, the particular issue, whatever. I understand you need to speak to the local authority, or maybe you can go to the independent person like, Citizen Advice Bureau and all those. I hope that will be sorted out. Maybe because we really do not know the situations, we do not know, so we can't comment on that. So it is always better use the independent authorities so that they can support you or whoever is not getting the support. And of course, yes, the children, like they can go to the school, because the school SEN team will help. Their special needs person are always there. And I understand your GP and all those are always, but at the moment I can't comment anything because we really do not know the situation.
Okay, great. Thank you. Any other question have we got, Joyanta? Would you like to put them up on screen, please? Yeah. How can one support an ADHD student in a maths lesson?
My bad. I think Nishchint got disconnected there. But
Hello.
so basically, there are some very interesting questions which have come up. Given the lack of time, we might want to pick up a couple of them. So this probably is Shukonna, since this is ADHD related, perhaps we can answer later on. If you can drop in a note to either to Dr. Nishchint Warikoo or Dr. Sarkhel, they can answer that. There were a few very other interesting questions. In fact, things like who and how does a child get referred to CETR? So is that something we can pick up here?
Definitely. If I may answer that question.
Sure, please.
Yeah. So CETR basically stands for Care, Education, and Treatment Plan, and this is available for young people who have either autism or learning disability. And what this basically means is the local authority, the education, and the local CAMS team, that's the mental health team, they all come together and have a robust plan for support to the young person. This can often be initiated by either the mental health team, by the social worker, or the school. So that the parent needs to contact them, and they should be able to initiate it, and it should offer them support in various forms.
Fantastic. Thank you for that. There's another question for the adults, and probably this is for Dr. Sarkhel. Is keen to know how an autistic adult deals. Autistic adults deal with their emotional and relationships and family life.
Yeah, it's quite a broad question, and I think I already sort of gave some pointers previously. What I would say that it's important to discuss that at an assessment level when they're assessed by a psychiatrist or psychologist. Is on laying down really what are the key trigger points, identifying that at an early stage, and also educating both the adult as well as the family. So a lot of the time is all about lack of information, and I hope that doing some of these programs like what we are doing now will cascade this information to the community. And it is not about blaming individual. It is about understanding, recognizing each other's different ways of communication. I mean, the key word is really the communication in the emotional relationships or family life. That is where most of the significant events happen. People become stressed, anxious. So I think that is important to bring it to the therapy session or with their psychiatrist, so that they can have a discussion. So it's difficult to tell anything a bit more specific because it all depends on individual to individual or family to family.
Okay. Thank you for that, Dr. Sarkhel. There's another one which I thought was important, and we'll finish with this question. And the question was, can autism develop later on due to social stigma? And there was a flip side of this, where in one of one of the presenters on BBC, she was told at a later point in time when she was diagnosed with autism in her 20s, that she was too pretty or too beautiful to be autistic. And and I thought, what kind of a answer would this be? And probably it's open to questions. Well, these are the two questions which are there, and would you want to pick this up?
Well, if I may, this one, because as I mentioned earlier, autism is a neurodevelopmental disorder. That means it's either present from birth or it doesn't happen later on. So yes, the diagnosis might happen later, as in this case of the TV presenter, and it goes with the common theme that girls and women get diagnosed quite late. But nothing as such would cause autism almost in the later form of life. Yes, there are social stigmas around it, and that's unfortunate. But at the same time, we need to remind ourselves that autistic people have achieved brilliant things. There is a word called savant, and which means people who are very, very intelligent or almost have superpowers in a particular field. Like some people on the autistic spectrum disorder, they can be very intelligent. They will be very good in maths or any particular field, which would be impossible for other people to achieve. So if someone has autism, that doesn't mean there are definitely going to be problems. They would have great things to offer and support and give to the social network and social people. So I think unfortunately there is a stigma around it, but that's really unfounded.
Thank you so much for that. And to the audience, thank you so much for being involved in this. If you have any questions, then I'm putting up on the screen. So if you have a question for Dr. Warikoo, you can contact him at info@welltechmedical.com. You can check his website out as well for Welltech Medical. That's a fabulous initiative that he and his team has. If you would like to get in touch with Dr. Sarkhel, then it's argo@doctors.org.uk. And if you want to get in touch with Sangeet Foundation or any other question, sangeet.foundation@gmail.com. So I think what I really missed out was Ujjwal's email address over here. And so I'm just trying to, so it's bangaujjwal@yahoo.com. I'll just type that out as well here. So that, right. So if there are any questions for Ujjwal, then you can get in touch with Ujjwal at bangaujjwal@yahoo.com. So thank you so much for that, audience, for being with us. Hopefully this was a very useful session for all of you. We'd like to follow up with some more sessions on autism. Do give us your feedback, what you felt about this. Do write in, do put comments in this video itself, or do write into our email sangeet.foundation@gmail.com. We'd love to hear from you, your feedback. What did you feel about the program? What did you like about the program? What would you like to hear about in autism? So if you have seen all the 4 sessions on autism, this is the 4th one. What else would you like to see? So we would like to we'd like to organize more informative sessions and more fun sessions in autism, because autism can be fun as well. So we can get that on. And of course, thank you so much. Our special guest for today, Dr. Nishchint Warikoo. I came across Dr. Warikoo because of the fabulous work they are doing in their initiative, and that probably we can talk later on about that, and you can check him out on the internet. So thank you, Dr. Warikoo, for being with us and for giving information on the child and adolescent autism. So
thank you for your help with this. Thank you for allowing me to be here.
It's a pleasure. And of course, Ujjwal Banga, who has addressed the social aspects of autism. That has been fabulous. Thank you for that. Thank you for being with us on
Thank you,
this.
Jayanta.
And then Dr. Sarkhel, who is part of Sangeet Foundation, is a trustee. And when I say he's a trustee, I really trust him to provide me with the guidance. You see, in terms of what exactly are we talking about and what should the program be about. So thank you so much for the guidance and being
Pleasure.
there, always with us.
Absolute pleasure, Janta.
Yeah. And finally, I think to putting this show together, putting this event together, and the questions and so incisive questions that you have had, and the insights that we have been able to draw out from the three panelists. Thank you so much for that, Noburupa, today for hosting this. Absolutely brilliant. So I guess with that we can close our event for today. And see you later on 10th. I'd like to repeat, we do have a session on mental health on World Mental Health Day with Living Mind and Sangeet Foundation.
See you then.
And of course, of course, I forgot. And any last comments or observations from you, Dr. Nishchint Warikoo?
Well, again, about autism, I think we need to understand that it's the people who are failing, people with autism, and we need to support them and allow them to help them to have a good functioning life. It's not a disease; it's just a disability, and we need to support them with that.
Thank you,
Exactly.
Dr. Sarkhel.
I think for me key thing is instilling hope. That help is available, support is available, and acceptance. So those are the two key words: hope and acceptance.
Fabulous. And Ujjwal Banga.
Oh, thank you, Jayanta. I mean, of course, yes. I just want to say that engage in conversation, communication, and speak to others. Don't stay in one area and don't feel bad that, oh my God, what exactly happening to me? Please speak to others. Please try to take help. It will, and support others. Don't keep them in a area where they will feel, oh my God, I'm alone. No, we all are together. Let's support each other.
Thank you. And Noburupa, would you like to close this then?
Well, thank you again. Really appreciate and all the conversations that we had today. It was very engaging. Thanks. It was very insightful. So again, a big thank you to all of you and Sangeet Foundation Jointo for creating this platform where we can actually using this platform to raise awareness. And all to all the viewers who are supporting, I'll mention this to you one more time, that you don't need always a platform. Now that you're getting to hear more about autism, just spread the word. Now this is how we can actually spread more and more awareness in the society. So thank you for your support. Thank you.
Thank you.